Good morning. Today we're going to be talking about understanding arthritis and a particular focus on rheumatoid arthritis. Thank you, Doctors Oba and Umeh, for coming on the program. It's a pleasure to meet both of you.
Thank you very much. Yeah.
So, Dr. Oba, if I can start with you as a rheumatologist, talking about arthritis, can you tell us about arthritis in general and what makes rheumatoid arthritis such an issue?
Okay. When you talk about arthritis, arthritis refers to the inflammation of the joint. Okay. Anytime the joint is inflamed, you will say we'll have arthritis. And it comprises of three things. The patient will complain of joint pain, joint swelling, and joint stiffness. Okay. So anything that can cause these three things in the joints can cause arthritis, or we say that is arthritis in the patient. And then it can be caused by different conditions. So you can have someone who has an infection of the joint having arthritis. You can have people who have inflamed joints for one reason or the other. They will also be said to have arthritis. Okay. And then there are some other conditions like what we call crystal arthropathies, when you have deposition of crystals in the joint, and it can also cause the joints to be inflamed, and it's called arthritis. Okay, so rheumatoid arthritis in general is a cause of arthritis. Rheumatoid arthritis is an autoimmune disease, and it causes arthritis. It causes inflammation of the joint. So what do we mean by autoimmune disease? What happens in autoimmune diseases is that there's a part of the body that, or what you call the immune system, that protects the body from external infections or external invasions of microorganisms. When this immune system malfunctions, what happens is that the immune system, rather than protect the body, attacks specific cells in the body, and then causes, brings about inflammation. In the case of rheumatoid arthritis, this inflammation, this attack on the body takes place primarily in the joints, okay? And you have, it now causes pain for the patient. It causes swelling. It causes what we call early morning stiffness. So that is basically what rheumatoid arthritis is about, as it's one of the causes of arthritis. There are lots of things. Infections too can cause arthritis, but rheumatoid arthritis is an autoimmune disease. And one of the reasons why it's of importance is the fact that it's not a common condition. You know, if you go to the clinic today, if you go to a typical clinic, you see more of malaria, you see more of hypertension, you see more of diabetes before you see rheumatoid arthritis. So people tend to see it as a rare thing, or this is an uncommon thing. And because of that, there's the issue of misdiagnosis and improper treatment, which can lead to all sorts of complications, especially when it's not detected early.
Okay, no, that's very interesting. Please carry on.
Okay, so the thing about this is that the symptoms of rheumatoid arthritis, I don't know if I can go on to symptoms. The symptoms of rheumatoid arthritis, usually, as I said, it is this joint swelling, joint pain, and joint stiffness, and it affects specific joints in the body. So it affects mainly the small joints of the hands. Okay, so the joints in the fingers, the joints at the wrists. It can also affect large joints like joints in the elbow, the shoulder, the hips, the ankles, and the small joints of the foot. Okay, in some patients, when it's really severe, it can give them chest pain because it affects the lining of the lungs and the heart. It can also, patients can also have fever and weight loss. So when you see a patient, you know, joint pains, fever, and weight loss, it's rheumatoid arthritis is one of the things that one should consider. Okay, and then when you talk about rheumatoid arthritis, in terms of diagnosis, there's no specific test that when we say there's this test we'll do and we'll make a diagnosis. What we do is that we look at the patient's conditions, the symptoms, and then the there are some specific tests we run. If those tests are positive in patients that have this specific symptom, then there's a likelihood that the patient would have rheumatoid arthritis. Some of these tests, we call them, they are serological tests, which involves things like rheumatoid factor, antibodies to cyclic citrullinated peptide, check the erythrocyte sedimentation rate, check the C-reactive protein. So that those are the tests we do. When some of these tests are positive in patients that have the symptoms I have outlined, then we can say they have rheumatoid arthritis.
Okay, thank you. I mean, that's been very comprehensive. Now, the thing about, when you spoke about rheumatoid arthritis, you talked about an autoimmune condition where the body is at war with itself. And it's something that, as you said, is not that common in Nigeria, but it is not uncommon either. People have it. Now, what can we do? Because, there's so many things now on the internet and so on about how if you eat these foods, it makes it worse. If you eat that food, it makes it better. Are there things people can do in their lives to prevent themselves from getting some of these autoimmune conditions, to actually protect themselves, and stop these things from happening?
I wouldn't say you can stop these things from happening because really people get hypertension and they don't know why, despite the fact that they do what they need to do. So it's more like having risks. There are risks where there are risk factors where if you have the risk for that kind of condition, then you avoid, if those risks can be avoided, then you can avoid. For example, in rheumatoid arthritis, smoking is a major risk factor. So if you can avoid smoking, you know that it reduces your risk of getting that rheumatoid arthritis. The other thing is genetics. If there are people in your family that have such illnesses, then you have a risk of having it. The only thing is that to prevent such things, you must now live a healthy lifestyle. You must not live a careless lifestyle, okay? Make sure your weight is within the normal, what you would expect your weight to be, and don't overeat or don't overindulge, okay? The other things is things like, we call those ones risks you cannot do, where you cannot remove, like sex, like age. The older you are, there's increase in likelihood of having rheumatoid arthritis, and females are at risk more than males. So I think more importantly than saying you want to prevent it, as I said, to have a healthy lifestyle and to have an index of high suspicion. Once you are ill and you don't know what's wrong with you, you go to the doctor quickly so that you are assessed. If you have that kind of condition, it can be treated early and managed so that you don't end up with complications.
Now, one of the critical parts or critical signs of rheumatoid arthritis is debilitating pain. So,
yes.
And you've talked about different kinds of pain. Now, how do this, we're talking about people in life. Is there a way, if you've been diagnosed with rheumatoid arthritis, perhaps early, you can then perhaps take some steps, maybe exercise, food, etc., to prevent yourself from getting into that position of having debilitating pain?
Yes, as you said, the most important thing with such conditions is early diagnosis. If you are diagnosed early, there's actually a chance of cure. If you are diagnosed within 6 weeks, 6 months, and we start the correct medication, your disease can actually go into remission and you might never have a recurrence again, okay? So that is one. The other thing with
is this with special treatment or, sorry, when you talk about going into remission, becoming cured, is that with a special treatment? Or,
no, it's with the basic treatment. It's basic treatment, but there's a window of opportunity that has been established. Once you are picked up early, there is a chance that you can have full recovery without having any remission. So the most important thing is early diagnosis. And then after being diagnosed early, okay, one of the most important, as I said, we're in a community where our area of the world, people still don't know much about this kind of condition. So a lot of people tend to, after seeing the doctor and getting diagnosed, they tend to listen to all sorts of people and try all sorts of things, you know. So, and one of the things that does is that it affects drug compliance, it affects clinic compliance, okay? So when you find out that they are trying all sorts of things and mixing all sorts of things, those are the things that make the conditions even worse, causing debilitation and deformity and things like that. Okay? One of the things I also advocate for my patients is that I tell them the diagnosis and I tell them to read about it and we discuss the condition. Because one of the things I believe in is that what you are not afraid of, what you're only afraid of what you don't know. But what you do, you're not afraid of. So if we're able to discuss it thoroughly and they know what to expect, okay, then it gives them confidence that, look, I can participate in my management and what is it called? The risk of it, that reduces the risk of having complications.
No, I think that's very interesting. And I look forward to hearing a lot more about it. Thank you very much. Thank you, Dr. Umeh, for joining us. I understand you have a foundation. Can you tell us why you set up the foundation, what that foundation does, and how you are making an impact on rheumatoid arthritis in Nigeria?
Okay, yeah, thank you very much for that question. I would like to start from what my colleague said, Dr. Abbas, about the name, what she said concerning people listening to people out there instead of the doctor about how to manage their conditions. So we found out that there's a whole lot of misinformation out there. People do all kinds of things that are not actually medical for their medical condition. So we felt it's important to educate the public. One thing is to wait for them to come to the clinic or to the hospital. Another thing is to meet them where they are by disseminating the information to them to help them to understand the right things to do. Number one is to understand what the illness is all about. Okay? To understand what the illness is all about, because most of them think it might be diabolic or things like that. So to educate them to understand what the illness is all about, how to manage the illness, whether it could be treated or not, but at least to get them to have the correct understanding of what to do. Are we making impact? Yes, we are making impact, and we are using the social media platform as a way to reach out to as many people as possible. Sometimes we also organize physical seminars, which is not that often, but is very easy to reach out to people online, okay, to educate them. So those who have come in contact with our programs, I could say they are happy for that because they would tell you all they have had. And most especially for non-doctors, because I would ask all these things you are saying, are they from doctors? They are for non-doctors, meaning that people do all kinds of wrong things, thinking that they are the correct treatment for arthritis, not only rheumatoid arthritis, but arthritis in general. Okay, so that's what the foundation is doing. And I think we are having impact. It has not been that long we are in existence. But I mean, we have reached out to as many as possible who are also right now doing the correct treatment for arthritis.
Okay, thank you. And I understand you have some specialization in pain management. So how do you help people with this intractable and often debilitating pain of rheumatoid arthritis? What are some of the measures you advise them to do, both drug and non-drug related?
Right. Yeah, for what my colleague earlier said, I'd also like to add one or two things there. In the definition of arthritis, usually it's commonly defined as inflammation of the joints. But in recent times, it has gone further, not just inflammation, but also there is destruction of the tissues of the joint, like the cartilages and the ligaments and all that, what is known as degeneration. Okay, and recently, most recent books define arthritis as degenerative disease of the joint. Okay, so if this is also what happens in rheumatoid arthritis, because when it starts destroying the cartilages and even the bone, you start having the deformation of the joints. So many researches have been going on. In fact, there's what is now known as regenerative treatment, a treatment that can regenerate the damaged tissues of the joint. It's still a new form of science that is being applied from that the patient presents early. If the patient presents early, it is possible now that tissues we used to think that cannot heal can heal when they are given the right environment. Tissues like the ligaments, the tendons, and the cartilage. So that's what is new in the treatment of this.
So would you call that, is that stem cell treatment, immunotherapy? What would you refer to that as? Thank you, Dr. Oba. It's been very interesting what Dr. Umeh has been speaking about. Those are some of the therapies that are now available. Would you say he was describing, stem cell treatment, or was that immunotherapy? What was he describing there in terms of regenerative treatment?
Yes. What I think what he was trying to describe is, as you said, probably some form of stem cell therapy. I know they have what you call platelet-rich plasma, which is taking like platelets or is particulates platelets from the body, or plasma in the body that is rich in platelets, and it's injected back into the joint because it's said to have some properties for regeneration within the joint. So those are the new things. But one of the things I would like to correct is that, as I said, in rheumatoid arthritis, autoantibodies are the ones that are causing the damage. Okay, and they actually affect the synovial lining of the joints. Okay, and that is what leads to the destruction. It affects the tendons too, as he said, but it is those tendons that have synovial lining. Okay, and what you have is that once you have that condition going on for long, it eventually leads to degeneration of that joint, and then this is called a degenerative joint disease. Yes. Okay, so when we are managing it, one of the important things is to calm down the inflammation within the joints, and also to bring the disease itself to remission. Because the disease itself is what causes the autoantibody affecting the synovium is what causes the inflammation. So initially you give drugs that will help to relieve pain, swelling, stiffness, and then you also give medications to treat the disease itself. Okay, and then some of these medications are the medications we use are what you call DMARDs. DMARD stands for disease-modifying anti-rheumatic drugs, and they are in different categories.
I think if we can, before we go into detail, because one of the questions that was asked was about, the age and the sex, and somebody, was calling in and asking about the age and sex of patients. What age does it normally start at, and why females? And would it always be genetic if it's female? The reason why I want you to bring this out is that you're talking very generally, but as you're going into these disease-modifying drugs, maybe you'll say who it's best suited for, so that we can have an idea of how best these things can be used.
Usually, you find rheumatoid arthritis. It can occur in arthritis can occur in any age, but usually rheumatoid arthritis starts from middle age. Okay, so you can have generally it starts from some people. It can affect some young people too, from the early age of 30s and 20s, but more commonly middle age, and then as you grow older, there's an increased risk. Okay, and then the thing about it is that yes, it's more common in females than males, and that has been postulated due to the effects of the female hormones. They feel the female hormones has an effect on the body and puts them at a higher risk of rheumatoid arthritis. Then the other thing is that when we say genetics, it doesn't mean that if your mother has it, compulsorily you must have it. There are certain parts of the genes that causes an increased risk for certain people. So if you have that risk, or if you have certain anomalies in your genes and it's in some people in your family, then there's the risk that you can have it. It does not mean that once the mother has it, the children too, or it's passed on in a Mendelian fashion. No, but that there's just a risk that other family members can also have the disease.
And so when we're going into the ones about the specialized drugs that can help the disease, do they work better in men? Do they work better in women? Or it really doesn't matter, they just work in everyone?
When you talk about specialized drugs, yes, as I said, they are called DMARDs, and there are different categories. I'm not sure. It's not the sex that determines what we give the patient. It is actually what works best. So what you do is that when you start giving these medications, you see how the patient is responding. You assess the patient's response to the medication. If they respond and the response is good, then you probably continue until as far as you can with that medication. But if the response is poor, then the thing is you go on to something else that might be more potent than the initial one to improve, to see whether the patient will get a response, or you will have a response in the patient. So you have like 3 different categories of drugs. You have the synthetic DMARDs, you have the biologics, which are the newer medications, and then you have small molecular.
Okay. So in general, though,
the drugs they call
is the fact that yes, we have drugs that can help, particularly
yes.
in early the early cases. And then how about things like exercise? How important are things like exercise and managing weight and other non-drug regimes in the treatment of rheumatoid arthritis, and indeed in arthritis in general?
Yes, in arthritis in general, and especially rheumatoid arthritis, it's a multidisciplinary approach where it's not just about the doctor and the patient, but you also involve the physical therapist, you involve the nurses, you involve the occupational therapist, okay? And then at times you even involve the psychologist, okay? So the thing about this is that when the patient comes, apart from the non-medical aspect of it, as I said, you discuss with the patient, you educate the patient about the condition and the treatment. Then the other thing you do is asking them to try and live a moderate lifestyle, to adopt a healthy lifestyle. Some of them, by the time some of these patients come, some of them would have even started developing deformities. So once you're able to reduce the pain, the next thing is to want to send them to the physical therapist to help to teach them exercises that will prevent their joints from getting deformed, okay? And then they are not like strenuous exercises, but just to keep the ligaments or those joints lubricated and moving. Yes. Then the other thing is that, as I said, some of them might have already developed deformities. So you want them to live the best life they can with these deformities. The physical therapist will still help, but you also have the occupational therapist who would now devise certain appliances that they can use in their daily lives that would help, and they can use in such a way that they won't have too much of pain, okay? Then, as I said, it's a new condition within an environment. Some patients will actually feel sad that why me, okay? So if you have to also address the psychological aspect of the condition. So you find that you talk to, yes, you talk to you at times you also involve the psychologist, so that would help in making sure the patient has a positive attitude towards the condition, and then also making sure that he takes his medication and then complies with doctor's instruction.
Thank you very much. You won't believe it, but our time is up at the moment. So do you have any very quick, just last words to say to our listeners?
Okay, as I said, it's not for me. I always tell my patient that having arthritis or rheumatoid arthritis is not a death sentence. You can still live your full life with it. as long as you listen to your doctors and have a good or a healthy lifestyle. Thank you.
Thank you. Thank you very much.
Thank you for watching. Please like, share and subscribe for new video updates.